Welcome to Fertile Minds. I'm Dr. Raelia Lew, a fertility specialist and Medical Director of Melbourne IVF. If you're considering IVF, understanding IVF success rates is crucial in making informed decisions about your fertility journey. Today, we'll break down IVF success rates. What do they mean? What factors influence them? And what to consider when choosing a clinic. How do you measure IVF success? There's no universal standard for reporting IVF success rates, which is why different sources may present varying statistics. IVF success is often reported in two key ways. The first measures success rates per complete IVF treatment cycle. A complete IVF treatment cycle can involve multiple embryo transfers from one egg collection. Success rates measured this way will naturally be higher than those measured per embryo transfer. The most common measure calculates the likelihood of pregnancy from a single embryo transfer, typically reported as the clinical pregnancy rate. A clinical pregnancy is confirmed by a blood test and ultrasound scan at around 6 to 8 weeks. Sadly, not all clinical pregnancies will lead to a live birth. That's why live birth rates per embryo transfer can provide a more accurate understanding of your chances of having a baby. In some IVF plans, we choose to freeze all embryos for various reasons. Some women may not produce viable eggs and some embryos may not develop. When comparing success rates, it's important to understand which stage of the IVF process a statistic measures. What factors influence IVF success? Several facts can affect your likelihood of success, including age. A woman's age is the most important factor. Fertility declines with age, particularly after age 36, as the number and quality of eggs decrease. That's why success rates are grouped by age. Comparing a 40-year-old woman with a 30-year-old woman isn't accurate. Embryo development. Embryos that reach the blastocyst stage on day 5 have the greatest chance of implantation, making their development a key factor in success. Sperm quality. Male fertility also plays a role. Poor sperm quality can impact embryo development and implantation success. Health and lifestyle. Lifestyle factors like BMI, smoking, and alcohol, as well as stress, can affect fertility and IVF success rates. Does embryo transfer type affect success? A common question is whether fresh or frozen embryo transfers are more successful. The answer depends on several factors, including your age, ovarian reserve, uterine health, the number of embryos available, and your overall treatment plan. Your fertility specialist will determine the best approach for your unique situation. The number of embryos transferred is also a factor to consider. Single embryo transfers can reduce the chance of multiple pregnancies and the associated risk. Pregnancy rate should always be interpreted in context of whether a single or double embryo transfer is undertaken. Comparing fertility clinic success rates. Success rates can vary greatly depending on the type of patients a clinic treats and its treatment strategies. That's why it's important to consider other factors when choosing a clinic, such as does the clinic offer a full range of fertility assessments and treatment? Have you found the right fertility specialist? Are they experienced, attentive, and aligned with your goals? Is the clinic conveniently located? Does the clinic invest in leading science, technology, and innovation? It's estimated that 80% of IVF success depends on the quality of your collaborative care team and IVF laboratory. Research and development in fertility treatments continually improve IVF success rates. Your fertility specialist, along with counsellors, nurses, and scientists, all work together to give you the best possible chance of success. Every fertility journey is unique, so finding a clinic that meets your individual needs is essential. Where can I find more information? Interpreting IVF success rates can be complex, and the best way to understand your personal chances of success is through a consultation with a fertility specialist. They'll discuss your individual situation, conduct fertility tests, and develop a tailored treatment to give you the best possible chance of having a baby. For additional resources, visit Your IVF Success, a website created by the Australian Government to help you navigate IVF statistics and compare clinics. Thanks for watching. Don't forget to subscribe for more fertility insights and expert advice.